Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a rheumatologist talking to a patient called Mr. Stewart. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Stewart. I see that your primary care physician referred you to me due to some concerns regarding muscle weakness and a rash that you've been experiencing. Could you tell me a bit more about your symptoms?
Yes, I've been feeling really weak, especially in my arms and thighs. It's been getting worse over the last few months. And then there's this rash that showed up on my face and hands. It's red and kind of scaly. At first, I thought it might just be eczema or something, but it doesn't go away, no matter what I try.
I see. That must be quite challenging. When did you first notice these symptoms?
The rash started about 6 months ago, and the muscle weakness followed not long after. I thought it might just be stress or something, but it's been getting progressively worse. And now, even simple tasks like getting out of a chair or lifting my arms to wash my hair are difficult.
It sounds like you're describing symptoms consistent with a condition called dermatomyositis. It's an inflammatory disease that affects the skin and muscles. The muscle weakness you mentioned, particularly in your proximal muscles like those in your arms and thighs, is a hallmark of this condition. And the rash, especially on the face and hands, is also typical.
Dermatomyositis? I've never heard of that. Is it serious?
It can be serious if left untreated, but with the right management, many people live well with it. The cause of dermatomyositis isn't fully understood, but it's considered an autoimmune disease, meaning your immune system is mistakenly attacking your body's own tissues.
That sounds pretty scary. What causes it to happen?
It's not entirely clear what triggers dermatomyositis, but it can be associated with certain infections, medications, or even cancers. However, in many cases, the exact cause remains unknown. What's important is that we focus on managing your symptoms and slowing the progression of the disease.
So what are the treatment options? Is there a cure?
While there's no cure for dermatomyositis, the symptoms can often be managed effectively with a combination of medications and physical therapy. We typically start with corticosteroids to reduce inflammation. In some cases, we also use immunosuppressants to help control the immune system's activity.
Corticosteroids? Aren't those pretty strong medications? I'm worried about the side effects.
They are potent, but they can be very effective in controlling the symptoms of dermatomyositis. That said, long-term use of corticosteroids does come with potential side effects, such as weight gain, high blood pressure, and increased risk of infections. That's why we usually try to taper the dose as soon as possible and might introduce other medications to help reduce the need for steroids.
And what about the muscle weakness? Is that something that can be reversed?
With treatment, many people see significant improvement in muscle strength. Physical therapy is crucial in this regard. It helps maintain muscle function and can even help regain some of the strength that's been lost. It's important to start therapy early and be consistent with it.
What about the rash? Will that go away with treatment?
The rash can improve with the same treatments used for the muscle symptoms. In addition to corticosteroids, topical treatments or other medications that target skin symptoms may be used. Protecting your skin from the sun is also important, because UV light can worsen the rash.
I guess I need to be more careful about sun exposure then. But what if the treatments don't work?
It's true that not everyone responds to treatment in the same way, but there are multiple options we can try. Sometimes it takes a bit of time to find the right combination of treatments that work for you. In more severe cases, we may explore other therapies like IVG, intravenous immunoglobulin, or biologic agents that target specific parts of the immune system.
It sounds like it's going to be a long road. How do I manage day-to-day life with this?
Managing a chronic condition like dermatomyositis does require adjustments, but with a good treatment plan and support, you can continue to live a full life. It's important to listen to your body, balance activity with rest, and stay on top of your treatment. Regular follow-ups with your healthcare team will also help us make any necessary adjustments to your care.
I'm glad we're catching this now. It's a lot to take in, but I feel better knowing there's a plan.
Absolutely. You're not alone in this. We'll work together to manage your symptoms and improve your quality of life. Let's start by arranging some tests to confirm the diagnosis, and then we can discuss the best treatment options for you.
Thank you, Doctor. I appreciate your help.
You're welcome, Mr. Stewart. We'll take this step by step. Let's get started on your road to managing this condition.
Extract 2. Questions. 13 to 24. You hear a pediatric gastroenterologist talking to a patient called Mrs. Luxes. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Luxes. I'm Dr. Naso Andrew, a specialist in pediatric gastroenterology. How are you and your son doing today?
Hi, Dr. Andrew. We're managing, but I'm really concerned about my son. He's been struggling with some bowel issues, and it's been quite tough for him.
I'm sorry to hear that. I understand how challenging this can be. Could you tell me more about what's been happening?
Of course. He's 8 years old, and for the past several months, he's been having accidents where he soils his underwear. It's been happening almost every day, and it's causing him a lot of distress, especially at school. We've tried everything we can think of at home, but nothing seems to work.
That sounds very difficult for both of you. I'd like to gather a bit more information to better understand what might be going on. Has your son mentioned any discomfort or pain when trying to use the bathroom?
Yes, sometimes he says it hurts when he tries to go, like he's straining, but other times he doesn't feel anything until it's too late. He's really frustrated because he doesn't want this to keep happening.
I see. When did you first start noticing these issues?
It started about 6 months ago. Initially, we thought it might just be a phase, but it's persisted. He's always had some trouble with constipation, even when he was younger, but this seems different.
It's not uncommon for chronic constipation to lead to a condition called encopresis, where a child might experience involuntary bowel movements because their bowel is so full that it's difficult to control. Has your son been diagnosed with constipation before?
Yes, when he was around 4 years old. We've been managing it with his diet, more fiber, lots of water, and cutting down on processed foods, but it doesn't seem to help much. We even tried some over-the-counter fiber supplements, but they didn't make much of a difference.
It sounds like we're dealing with a case of encopresis, likely due to his history of constipation. Encopresis can be managed, but it does require a comprehensive approach. We need to ensure his bowels are moving regularly and that he's not holding onto too much stool. Has he been on any treatments or medications for this recently?
We tried some over-the-counter laxatives, but they didn't seem to help much. He'd have loose stools for a day, but then it would go back to the same problem. We just can't seem to find the right balance.
That's understandable. Over-the-counter treatments can sometimes be too mild for chronic cases like this. We might need to prescribe a stronger medication to help soften his stool and make it easier for him to pass. Along with that, it's important to continue with dietary adjustments and ensure he's drinking plenty of water. We'll also work on establishing a regular bathroom routine to help his body develop a pattern. Have you noticed any emotional or behavioral changes in your son since this started?
Yes, he's been really down about it. He's embarrassed, especially at school, and I can tell it's affecting his confidence. He's more withdrawn, and he doesn't want to talk about it much.
That's completely understandable. Encopraises can be very distressing for a child, particularly at his age. Addressing the emotional aspect is just as important as the physical treatment, in addition to the medical approach. I'd recommend we also involve a pediatric psychologist who can help him manage the stress and anxiety this condition might be causing. It can make a significant difference in his overall well-being.
That sounds like a good idea. I hadn't considered that before, but I think it could really help him. We just want him to feel better and not have to deal with this anymore.
We'll work together to make sure he gets the care he needs, both physically and emotionally. I'll prescribe a medication to help regulate his bowel movements, and we'll refer him to a specialist for behavioral therapy. It's important to approach this with patience and understanding, as it can take some time to see improvements. We'll stay in close contact to monitor his progress and adjust the treatment plan as needed.
Thank you so much, Dr. Andrew. I really appreciate your help. I feel a lot more hopeful now.
You're very welcome, Mrs. Luxes. We're here to support you and your son every step of the way. Please keep us updated on how he's doing, and don't hesitate to reach out if you have any questions or concerns. We'll work through this together.
I will. Thank you again for everything.
Take care, Mrs. Luxes. We'll be in touch soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional explaining a septic technique. Now read the question.
In a healthcare setting, mastering the aseptic technique is vital to preventing infections during medical procedures. Aseptic technique encompasses a range of practices designed to minimize contamination by pathogens. These practices include sterilizing equipment, disinfecting surfaces, and maintaining a sterile environment throughout the procedure. For instance, when inserting a catheter, it's essential to clean the area around the insertion site thoroughly and use sterile gloves to prevent introducing bacteria into the body. Additionally, during surgery, maintaining a sterile field is critical, ensuring that all instruments, drapes, and surfaces that come into contact with the patient are free from contaminants. Proper hand hygiene is another crucial component of aseptic technique, as it reduces the risk of transferring microorganisms. The use of personal protective equipment (PPE), such as sterile gloves, gowns, and masks, further aids in maintaining sterility. By understanding and consistently applying aseptic techniques, healthcare professionals can significantly reduce the risk of healthcare-associated infections, thereby safeguarding patient safety and improving overall care quality.
Now look at question 26. You hear a nurse and a patient discussing post-surgery care. Now read the question.
Yes, but make sure the water is lukewarm and you pat the area dry. After cleaning, what comes next?
I need to apply the antibiotic ointment you prescribed.
Correct. And remember, you should use a clean cotton swab to avoid infection. How often should you change the dressing?
Twice a day, once in the morning and once in the evening.
That's right. Also, it's important to avoid any heavy lifting or strenuous activity. Why is that?
To prevent reopening the incision or causing any complications.
Exactly. And if you notice any unusual redness, swelling, or discharge, what should you do?
Contact the clinic immediately.
Now look at question 27. You hear two healthcare professionals discussing a patient's treatment plan. Now, read the question.
Hi, Maria. How are you? Can I run something by you quickly?
Sure, Dr. Collins. What's up?
Have you gone over Mr. Thompson's latest treatment plan? He's been prescribed a new medication, and I'm concerned about the dosage.
Yes, I reviewed it earlier. The dosage seems a bit high for someone with his medical history, doesn't it?
Exactly. I called the pharmacy to double-check, and they confirmed it's the correct dosage, but I still think we should be cautious.
Did you reach out to Dr. Patel yet? She's the one who has been managing his case from the beginning.
Not yet. I was thinking about doing that. But I wanted to get your input first.
I definitely recommend consulting with her before making any decisions. She might have a different perspective on the treatment.
You're right. I'll talk to her now.
Now look at question 28. You hear two hospital administrators discussing the new patient intake procedure. Now, read the question.
We've implemented the new digital intake system, but it seems like only about 35% of the patients are using it so far.
That's quite low, especially since the system is supposed to streamline the entire process. Should we remind the staff to encourage patients to use it?
I've already sent out 2 memos and discussed it in our team huddles. It might be time to bring it up in the upcoming department-wide meeting.
The one scheduled for Tuesday morning? Do you think everyone can attend?
Most should be able to, but if someone can't make it, we can discuss it with them directly after the meeting to ensure they understand the importance.
Now look at question 29. You hear a presentation about a new approach to managing vascular dementia. Now, read the question.
Thank you all for joining today. After thorough evaluation, the hospital has decided to adopt a new strategy for managing patients with vascular dementia. Traditionally, treatment has focused on managing symptoms with medications like cholinesterase inhibitors, but these can sometimes cause side effects such as nausea and loss of appetite. The new approach emphasizes a combination of lifestyle changes, such as regular physical exercise and a healthy diet, which have been shown to improve cognitive function. While these changes require commitment and time, they are significantly beneficial in slowing the progression of the disease. Most importantly, studies have demonstrated that this approach can also reduce the risk of further strokes, which are a major cause of cognitive decline in these patients. Based on these findings, we believe this comprehensive strategy will enhance the quality of life for our patients with vascular dementia.
Now look at question 30. You hear a nurse explaining a new medication administration process. Now read the question.
Should we double-check all medication doses before giving them to patients, or is it enough to rely on the automated dispensing system?
That's an important question. Even though our new system is designed to reduce errors, it's critical that you still perform a manual double-check of all doses. We are transitioning to this technology to enhance patient safety, but there is still room for human oversight to catch potential mistakes that the system might miss. I understand this adds an extra step, but it's vital for ensuring patient safety.
So we need to manually check each dose before administration?
Yes, that's correct. Exactly. Any more questions?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a pediatric endocrinologist giving a detailed presentation on dwarfism. You now have 90 seconds to read questions.
Hello, my name's Dr. Sarah Mitchell. I'm a pediatric endocrinologist, and today I'm going to discuss a condition known as dwarfism. Dwarfism is a medical or genetic condition that results in an adult height of 4 feet 10 inches or shorter. There are over 200 different conditions that can cause dwarfism, but the most common type is achondroplasia. Achondroplasia accounts for about 70% of all cases and is characterized by short stature with disproportionately short arms and legs, a large head, and a prominent forehead. It's important to note that while the condition primarily affects bone growth, individuals with dwarfism can lead healthy and fulfilling lives. However, due to the condition's rarity, it's often misunderstood, and there can be significant misconceptions about its impact on physical and intellectual abilities. The cause of dwarfism varies depending on the type, but it generally results from genetic mutations. In the case of achondroplasia, it's caused by a mutation in the FGFR3 gene, which affects the development of bone and cartilage. This mutation can occur randomly, but it can also be inherited from one parent with the condition. It's crucial to clarify that most cases of dwarfism are not related to any preventable factors, and that environmental influences during pregnancy, such as nutrition or lifestyle, do not cause the condition. Furthermore, people often wonder if dwarfism affects intellectual development, but in most cases, it does not. Individuals with dwarfism typically have normal intelligence and can achieve success in all areas of life. Let me share a recent case that highlights some of the challenges faced by individuals with dwarfism. A 10-year-old girl named Lily came to see me with her parents because they were concerned about her short stature compared to her peers. Lily had been healthy overall, but her growth had noticeably slowed down by the time she was 3 years old. After conducting a series of tests, including genetic analysis, we diagnosed her with achondroplasia. Lily's parents were initially worried about how this condition would affect her future, particularly in terms of her physical abilities and social life. We discussed the importance of early intervention, including physical therapy to help improve her strength and coordination, and how adaptive strategies could support her in daily activities. I reassured them that with proper support, Lily could live a fulfilling life, participate in most activities, and achieve her goals. When managing dwarfism, it's important to address both the physical and emotional challenges that patients may face. Research shows that children with dwarfism are at a higher risk of experiencing bullying and social isolation, which can lead to anxiety and depression. Therefore, it's essential for healthcare providers and families to work together to create a supportive environment that fosters self-esteem and resilience. For example, encouraging participation in activities where height is less of a factor, such as swimming or music, can help children develop confidence. Additionally, educating schools and communities about dwarfism can reduce misconceptions and promote inclusivity. Another case that illustrates the need for ongoing care is that of a 35-year-old man named Mark who has achondroplasia. Mark had been managing his condition well, but he recently began experiencing chronic back pain, a common issue for adults with dwarfism due to spinal stenosis, which is the narrowing of the spinal canal. This condition can compress the spinal cord, leading to pain and neurological symptoms. Mark had been hesitant to seek treatment because he feared it would interfere with his work. After discussing his concerns, we decided on a conservative approach, including physical therapy and pain management techniques, to help alleviate his symptoms while allowing him to continue working. This case highlights the importance of addressing both the medical and personal concerns of patients with dwarfism to ensure they can maintain their quality of life. When it comes to treatment for dwarfism, there's no cure, but there are various ways to manage the symptoms and complications associated with the condition. Early diagnosis is key to ensuring the best possible outcomes. For example, growth hormone therapy may be an option for certain types of dwarfism, although it is not effective for achondroplasia. Surgical procedures, such as limb lengthening, can be considered in some cases, but they are controversial and come with significant risks. More commonly, treatment focuses on managing symptoms, improving quality of life, and supporting independence. Patients often ask if they should follow a specific diet or lifestyle to manage their condition. While no special diet is required, maintaining a healthy weight is important, as obesity can exacerbate complications like joint problems and back pain. Additionally, regular exercise that focuses on strength and flexibility can be beneficial. It's also essential for patients to have regular checkups to monitor for potential complications, such as spinal issues or respiratory problems.
Extract 2. Questions 37 to 42. You hear a conversation between a interviewer and Dr. Emily Harper discussing her recent study on brucellosis. Now, read the questions. You now have 90 seconds to read questions.
Welcome to the show. Today, we have Dr. Emily Harper from Johns Hopkins University. Dr. Harper is here to share insights from her recent study on brucellosis, a zoonotic infection that has significant implications for both public health and the agricultural industry. Dr. Harper, thank you for joining us today.
Thank you for having me. I'm eager to discuss this important topic.
So, what was the main takeaway from your research on brucellosis?
The primary finding from our research is that brucellosis remains a significant public health issue, particularly in regions where livestock farming is prevalent. Despite efforts to control the disease, it continues to persist, largely due to the close interaction between humans and animals, especially in rural areas. Our study highlighted that while brucellosis is often underdiagnosed, it can lead to chronic health issues if not treated properly. We also found that public awareness of the disease is low, which contributes to delayed diagnoses and ongoing transmission.
That's concerning. What are the primary challenges in diagnosing and managing brucellosis?
One of the biggest challenges is the non-specific symptoms of brucellosis, which often resemble those of other febrile illnesses such as the flu. This can lead to misdiagnosis or delayed diagnosis. Additionally, there's a lack of awareness among both healthcare providers and the general public about the disease, particularly in areas where brucellosis is not commonly thought of. Another challenge is that brucellosis can become chronic if not treated promptly, leading to long-term complications such as arthritis, endocarditis, and neurological disorders. Effective management requires a combination of antibiotics over an extended period, which can be difficult for patients to adhere to, especially in regions with limited access to healthcare.
Given these challenges, how can healthcare providers improve the diagnosis and management of brucellosis?
Education and awareness are crucial. Healthcare providers, particularly those in endemic areas, need to be trained to recognize the symptoms of brucellosis and consider it in their differential diagnoses. Early diagnosis is key to preventing the chronic complications of the disease. We also recommend the use of more sensitive diagnostic tests, such as polymerase chain reaction PCR assays, which can detect the bacteria more accurately than traditional methods. Furthermore, public health campaigns should be aimed at educating the general public, particularly those in rural and agricultural communities, about the risks of brucellosis and the importance of seeking medical care if they experience symptoms.
What specific benefits did your study identify in terms of early diagnosis and treatment of brucellosis?
The most significant benefit of early diagnosis and treatment is the prevention of chronic disease. Patients who are diagnosed early and receive the appropriate antibiotic therapy are much less likely to develop the severe, long-term complications associated with chronic brucellosis. Our study also found that early treatment reduces the risk of transmission, particularly in households where other members are at risk of exposure. Additionally, patients who are treated early experience a faster recovery and a significantly lower recurrence rate. This highlights the importance of timely intervention, not only for individual health outcomes, but also for broader public health efforts to control the disease.
How have patients responded to the treatments for brucellosis, particularly in areas with limited healthcare access?
Patients generally respond well to the treatment regimen, which typically involves a combination of antibiotics like doxycycline and rifampin over a period of several weeks. However, adherence to the full course of treatment can be challenging, particularly in areas with limited healthcare access. Some patients find it difficult to continue the medication for the entire duration, especially when symptoms improve early on, leading to incomplete treatment and the risk of relapse. There's also the challenge of managing side effects from the antibiotics, which can sometimes be severe. To address these issues, healthcare providers need to offer strong support and follow-up care to ensure patients complete their treatment.
Were there any criticisms or areas for improvement identified in your research on brucellosis?
Yes, while the majority of feedback was positive, there were some areas for improvement. One major issue is the need for better surveillance systems to track cases of brucellosis more accurately. In many regions, the reporting of brucellosis cases is inconsistent, leading to gaps in data and an underestimation of the disease's true impact. Another area for improvement is the development of more effective vaccines for livestock, which would help reduce transmission to humans. Lastly, the study highlighted the importance of integrating brucellosis management into broader healthcare initiatives, particularly in rural areas where resources are limited. By doing so, we can ensure that brucellosis is addressed alongside other health priorities.
It's clear that there's still much work to be done to control brucellosis. What do you see as the next steps in combating this disease?
Moving forward, I believe the focus should be on strengthening both human and animal health systems. For humans, this means improving diagnostic capabilities, expanding access to treatment, and increasing awareness through public health campaigns. On the animal side, more effective vaccination programs and better livestock management practices are essential. Additionally, global collaboration is crucial. Brucellosis is not confined to one region, so international cooperation in research, surveillance, and control efforts is needed to reduce its impact worldwide. Finally, continued research into new diagnostic tools, treatments, and vaccines will be vital in overcoming the challenges we face in controlling brucellosis.
Thank you, Dr. Harper, for sharing your expertise. It's clear that brucellosis is a complex issue, but your insights have provided a better understanding of the disease and how it can be managed.
Thank you for having me. I'm glad to have had the opportunity to discuss this important topic.
That is the end of Part C. You now have 2 minutes to check your answers.